Have you ever felt awkward bringing up anal sex with your doctor? Well, you're not alone. And talking about anal sex with your provider isn't weird, it's essential. Today I want to discuss something called anal dysplasia. Anal dysplasia is precancerous cells that develop within the anus, and this often results from the HPV virus, human papillomavirus, which actually is the #1 sexually transmitted infection within the world. There are a number of strains of the HPV virus, and predominantly the strains 16 and 18 have a high risk of developing anal cancer. Anal cancer actually is pretty rare. It's found in maybe 1.6 out of every 100,000 people in the world. However, those living with HIV and those that have anal receptive intercourse are at particularly higher rates of development of anal cancer, otherwise known as anal squamous cell carcinoma. There's actually been a trial that recently was published in 2022 called the Anchor trial. And this was a group of providers who specifically looked at the surveillance and treatment of precancerous lesions within the anal lining. This study focused on those people living with HIV and those men who have sex with men. Within this population, the group randomized over 10,000 people living with HIV at ages greater than 35. It tested whether treating high-grade squamous intraepithelial lesions, otherwise known as high-grade dysplasia, or precancerous anal tissue, would stop them from turning into cancer. These participants were screened by using anal pap smears and high-resolution anoscopy. Anal pap smears are a very simple test that can be performed in the clinic. What we do with anal pap smears, which is similar to a cervical pap smear, is we use a gentle probe that gets inserted gently within the rectum, and the swab of cells is taken from the lining between your colon where it starts and the rectum where the colon ends. Once this swab is taken, it is then placed in a small thin prep jar. This is sent to the lab, and our cytopathologists or those that are experts at looking at these cells under the microscope are able to provide us a diagnosis of the screening. This is a very simple test. It can be performed in clinic, and there's actually some good research to demonstrate that patients can do self-collection of the test with similar results. Following this test, the high-resolution anoscopy is essentially a high-grade microscope that's able to look at the anal lining and identify areas that are concerning for this dysplasia or precancerous cells. So going back to the study, about 4,400 patients that were confirmed with high-grade squamous intraepithelial lesions or precancerous cells were randomized into those being treated versus those that were just monitored with repeat high-resolution anoscopy or pap smears. The treatment methods were the inclusion of electric cautery, which is kind of burning the area, excision of the area, biopsy of the area, or ablation, which is another form of burning. These were very interesting results, and after 2 years, 9 participants who received treatment developed anal cancer compared to 21 in the monitored group. That's a 57% reduction in cancer incidence with treatment. Most side effects were very mild, like temporary pain or bleeding. So why does this really matter? Well, it proves that treating precancerous anal lesions works, similar to cervical cancer prevention. This paves the way for new screening guidelines, and now the CDC recommends that high-grade squamous intraepithelial lesions get screened for people with HIV. This sets the precedence for screening other high-risk groups, such as HIV-negative men who have sex with men, immunocompromised individuals, as well as women that's had a history of high-grade squamous intraepithelial lesions within the cervix. So why does this remain a challenge? Well, high-resolution anoscopy requires training. It is intensive and limited. We need better treatment tools. The current options do often see recurrence. Therefore, if we find this high-grade changes to the anal lining, it often requires multiple procedures in the future to completely clear the tissue. In addition, finding biomarkers for those who are increased risk for this high-grade dysplasia will help progress the management and target treatment options. So in summary, again, discussing anal sex with your provider is important. It's important to seek potential screening options to help prevent anal cancer. If you're living with HIV, then this is extremely important, and I certainly recommend that you seek care from a healthcare provider trained in performing not only anal pap smears, but also the treatment options for this as well. This is a simple test. It can be performed by your primary care provider. It can be performed by yourself. But it's important to seek care from a colorectal surgeon who is trained in performing high-resolution anoscopy so you can have the appropriate surveillance and treatment that is required. I hope that as we continue to provide this service to patients, that we will continue to improve our accuracy and treatment and make significant efforts around the world to reduce the risk of anal cancer.